Well, about 65 million Americans are affected by bunion deformity. Bunions are not only unsightly, they can also lead to other medical conditions.
So today we have Dr. Amber Shane, DPM from Orlando, Florida, and her patient Jody Woodside. She joins us remotely from Satellite Beach, Florida, to tell us about an innovative surgical solution that addresses the root cause of bunions. Welcome, doctor.
Welcome. Thanks, Olga.
Thanks so much for being here. And of course, welcome to you, Jody, as well.
Yep.
Doctor, let me start with you. Can I tell her?
Yes, go ahead.
All right, he has a bunion. What foot?
It's on the right one.
Okay. What causes it?
Traditionally, people think a bunion is just a bump bone on the side of the foot. But technically, a bunion is actually the misalignment of the first metatarsal bone. It sticks out and it's rotated, and that's the protrusion you're seeing out of the side of the foot. So it's actually your bone sticking out of the side of the foot and not just a bone buildup. Traditional bunion surgery was just shaving down the bump or cutting the bone and shifting it over. So in order to address it properly, you have to take the entire bone and realign it back into position.
Well, Jody, now how are bunions affecting your life?
I had bilateral bunions as long as I can remember. First memories were probably high school, getting bigger going into college for sure. They were a great source of entertainment, and then just continued to grow and get larger in my career. They were affecting me because most of my job as an executive director in a memory care facility was spent on my feet. Bunions prevented me from wearing pretty shoes. If I wore heels, absolute misery. Could not wear heels at all.
So, doctor, when Jody came to you to treat her bunion, number one, is she like the typical patient? And you used an innovative surgical solution, and tell me about that.
Yeah, Jody is a good patient for this because she was in her young 50s, healthy, active person, just having trouble with her lifestyle due to this bunion that's affecting her. When I first met her, we discussed the Lapiplasty Technique. So Lapiplasty is a surgical approach that's been adopted by foot and ankle surgeons throughout the U.S. Lapiplasty is an innovative solution that addresses the root cause of the bunion, and it actually rotates the entire malaligned metatarsal bone back into place, and it secures the unstable joint. And patients are typically back in their feet in a protective walking boot within 1 to 2 weeks of surgery.
So Jody, what was your experience like with Lapiplasty?
When I went in for the initial consultation, she said, yes, surgery was the only option for me. She did an assessment and determined that I was a candidate for Lapiplasty, and I was thankful at that point that I was a candidate. I put off the surgery for 8 months after I got the referral. I finally made the appointment with Dr. Shane. I had the first surgery in June of 2020, and the second surgery was October of 2020. I am able to walk for exercise. I can do cardio, I can run, I can do any regular exercise activities.
Doctor, it seems like Jody has fared quite well. Tell me about, her results, and is this covered by insurance?
Yeah, so her recovery was she got back into a walking boot within a few weeks after surgery, and she got back to her normal lifestyle activities of going to work, taking care of her children, exercising, and as far as insurance goes, most insurances do cover this. You can find that out from your local insurance agency or from your local foot and ankle surgeon that you visit for this procedure.
Wow. Jody, any final thoughts?
Now I can wear flip-flops and pretty shoes if I want to. I'm feeling great. And I would highly recommend the Lapiplasty procedure to anyone with bunions.
Dr. Shane, I was reading here that there are some potential risks. They include infection, pain, implant loosening, and finally, loss of correction with improper bone healing. But is that kind of like what's expected, if you will, with any kind of surgery?
So anytime you have surgery, pain and infection are the first two obstacles you want to get through and try to not have your patients have. And that can happen if you have your appendix out or if you have your bunion fixed. And then anytime you do bone surgery anywhere in the body, the health of the patient can affect the outcome healing. You can have risks of slower healing depending on the lifestyle, the activity. So those are common risks with any bone surgery that you have.
If people want to get more information, where would they go?
Yeah, so there's a website, lapiplasty.com, that has patient videos, testimonials, information about the procedure, as well as they have a find a local surgeon near you that does this procedure.
Sounds great. And Jody, just wanted to wish you the best. Thank you so much for sharing your story. Good luck to you.
Thanks so much, Doctor, for being here.
Thank you, Montel, Olga.
No, thank you for being here.
Sure, and if you want more information, you can always go to our website, thebalancingAct.com.
We'll be right back.